What type of treatment is completely surgical as far as cosmetic is concerned? I mean, you said about the non-surgical part. Then what part is surgical?
Okay, so
Or is
that
is rhinoplasty surgical?
Rhinoplasty is surgical. There are some people who do non-surgical rhinoplasty. They'll inject some filler, which is temporary. I'm not a big fan
It's
of this
aligning
procedure.
the nose bone, right?
So aligning, making the shape different, tip smaller, tip bigger, or the sides of the nose smaller.
And it's a growing trend.
It is a growing trend.
It's a global growing trend.
Yes,
I see that the trend is growing.
Yes. So surgically, if you talk about procedures, they start with the upper face for eyelids, for eyebrows, for droopy eyebrows. Then there is facelift, neck lift, ear reshaping. Sometimes people have prominent ear on the sides. Then fixing them to the skull, hair transplant. Then neck lift, chin augmentation can be so. Let's say
When there's so much of demand,
yes,
it means the industry will be evolving every month or every 6 months.
it is.
How do you keep yourself updated?
Now,
Because it's so much difficult for you. I
Yes.
mean, you're functionally involved in everyday's work,
yes,
and now you need to upgrade yourself every day
correct,
to make sure that you read the latest news
correct.
and you're in line with the latest techniques that's available.
Yes. So one thing is you always keep attending conferences and read journals. What is the latest research with what is going on in your specialty, but also very important to look at trends which are on social media. People come up and say, "Doctor, can you do a Texas jawline?" And it's nowhere in our textbooks, nowhere in the research, nowhere in the books, but it's there on the social media. A Texas jawline is a strong masculine jawline, which has been seen in people of Texas.
Okay.
And ladies wanted to have a sharp jawline. It's called a Texas jawline. Similarly,
But don't you think it should be compatible with their genetics as well?
so
Or is that any, you could, it
not
may not have a
necessarily.
side effect?
Not necessarily.
Okay.
If not overdone, if not done in a way that that will harm a patient, then no. Sometimes people will say silk recontouring, which is nowhere in the books, but it's on social media.
That's permanent makeup, yeah?
Yeah, so there are
So
different.
you wake up
yeah.
fresh with makeup, yeah?
So you need to keep pace with all these trends also, and also legitimate research on journals, on in conferences.
So, I mean, when you meet a lot of clients on the cosmetic forefront, what type of patients do you meet, or what type of clients you can meet? I will not even call them patients,
Yes.
in fact,
Yes,
because they are not patients.
Yes.
Actually, they come with more enhancing
Yeah.
requirements
right.
and something that's in the trend.
Yeah,
So,
we
are
like
they
to
models?
call them clients.
Yeah, you call them clients. Okay,
Yes,
that's what I'm saying.
yes.
So they're morely, I mean, they're models or they are film stars.
There are models, who come to me. I've done a lot of cabin crews. I've done a lot of models, but then
What's
I've
the gender percentage when it comes to male, female?
I would say 60% are female, but
60%.
40%
40% are male.
are men.
Okay. And
Yeah.
what they come for?
So
Don't tell me that a male comes for jawline. I don't
so
think.
much.
Yeah?
You would be surprised.
Okay.
Yeah. One of the commonest procedures is liposuction.
Liposuction.
Yes.
Okay. I mean, because of the obese.
Gynecomastia.
Okay.
Very common. Botox is very common.
Botox is common.
Extremely common.
Yeah. Okay.
And, part of demographic is just housewives who had 4 kids, 5 kids. Now they want to take care of their bodies, lose skin, excess fat. So it's not just those models who like to do
What's
this.
liposuction? Let's get into the basics of liposuction. I mean, is it a surgical procedure?
As simple
Or
as
is it just
it's a surgical procedure. Yeah.
Or is it just you pull up the you vacuum the entire fat out of the body?
Literally, we do that. But it's surgically under anesthesia, either local or full
So
anesthesia.
you put an anesthesia.
Yes.
Okay. And what's the time?
Now, again, depends on how much is the liposuction which we need to do. It can be sometimes just a double chin,
Okay.
or it can be a
Big
huge
belly, yeah.
obese, big belly. So liposuction is not for weight loss, but it's just to remove the fat which is stubborn, which is not going otherwise by exercise and diet control.
Okay.
Yeah.
So if you remove this fat,
Yes.
will it come again?
It
One more
can.
thing. And does the tissues in the process get damaged?
Okay.
Because there's a lot of fear.
Very valid
Because of the
question.
unknown.
Yeah. Very
That's where
valid
we want to
question.
clear that doubt.
Yeah.
Because most of the people say, okay, liposuction is there. I want to do liposuction because I tried my best to reduce my weight, but I couldn't reduce it.
Right.
My fat is getting stubborn.
Yes.
I mean, of course, this fat did not come in a day. It came maybe out of 2 years, 3 years, 4 years.
Absolutely.
But it's not going down. When it's not going down,
Yes.
so you went for a treatment, you want someone to suck it out.
Yeah.
But is it going to come again? And during that sucking out procedure, is it going to damage the tissue and how safe it is?
Okay. So the number of cells which contain fat is fixed.
Okay.
When we remove these cells, when we remove this fat, the number of cells is reduced. But then every cell has a capacity to grow up to 40 times its size. So fat can come back if you don't fix your lifestyle. It has to be complemented